The Medicaid Managed Care Taskforce released its final report this week detailing how they plan to control the Medicaid welfare budget behemoth that is Medicaid. So what does this grand plan entail? Unfortunately, only more of the same. The committee chose not to recommend any policy changes aside from creating yet another study committee and more quality metrics. It is notable that the committee failed to acknowledge a key provision in its recommendations that it was charged to investigate: how to reduce costs. With the preliminary numbers for the 2025 Medicaid budget exceeding $4.7 billion, taxpayers should be concerned about the legislature delaying the adoption of real solutions. We will dive into this report and preview what is ahead for Medicaid in 2024 on this week's episode of Fiscal Fridays. The Medicaid Managed Care Taskforce spent the better part of the summer hearing testimony about the challenges and potential fixes for Idaho's Medicaid program. After all, the task force was originally designed to reduce costs, achieve a predictable and transparent budget, improve health outcomes for beneficiaries, ensure the program's adequacy, and consider the costs and benefits of a managed care payment model. It was good that the committee decided against adopting a managed care payment model. Nationally, there is no evidence that the system would have reduced costs, and it would be a boon for large health insurance companies. It would have been a solution without results, leading Idaho down the same path we're on now of big spending and welfare dependency. The committee had the authority to look beyond the prospect of switching to managed care, however, with the goal of finding new ways to reduce costs and improve the program. But they decided to stay the course on Idaho's Medicaid program with the caveat that they create another, more permanent study committee to set new quality metrics and oversee the program. The idea is that it would give the still new value-based payment model time to prove its effectiveness. But the addition of new quality metrics and more studies is redundant and only delays the implementation of real solutions. The whole point of the value-based pricing model is that healthcare providers must meet certain spending and quality metrics to secure their savings. Ultimately, the committee finished where it started, a broken system with no real solutions. Taxpayers should be concerned about the prospect of staying the course on Medicaid. The preliminary numbers are in on the 2025 Medicaid budget request. If passed, it would be the largest budget the division ever received. This is despite cleaning about 100,000 ineligible participants off the rolls. This alone was projected to save $245 million. This record spending also does not include a provision to expand Medicaid coverage to higher earners and for a longer period of time for postpartum women. In fact, the total cost of the welfare expansion is still largely unknown. Overall, Medicaid has a history of being a low-value program that is exacerbated by expanding coverage to able-bodied, working-aged adults. Several studies from the Mercatus Center found that Medicaid expansion siphons resources from the truly needy. The expansion population is also the leading driver of the cost growth of the program. They drive much of the spending in optional services like prescription drugs, which is the fastest-growing spending category in the program at the moment. Real solutions would require tough choices. Real cost control would require taking on one or more of the following options: reducing service use, reducing prices, or reducing enrollment. This may require cutting optional coverage options like dental or some prescriptions. This may also require investigating how providers are billing the state for services and tamping down on Idaho's severe issues with improper payments. This may also require repealing expansion coverage for able-bodied working-age adults. This entitlement is harming the truly needy on the program and the healthcare market more broadly. Again, these are tough solutions the legislature must consider to truly bring the program under control. There needs to be less of an emphasis to get as many people enrolled in government medical welfare as possible. Instead, we need to find ways to promote independence from the system, reducing costs by virtue of people no longer needing the government to get by. To wrap up, the committee's decision to maintain the status quo on Medicaid ignores their charge to reduce costs. Savings will only come from reducing prices, use, or enrollment, and there needs to be more serious policy discussions about taking on these issues. Otherwise, Medicaid costs will continue to overrun the Idaho budget, and taxpayers will pay dearly. So what do you think? Did the committee make the right call on Medicaid policy reform? Tell us in the comments below, or send us an email to media@idahofreedom.org. For more episodes of Fiscal Fridays or other great content from Idaho Freedom Foundation, please visit idahofreedom.org.